Hi, I'm Cloverine Louise, and I love learning new things. Let's turn the pages in our textbook and learn together. How can you use your education, your skills, and your intellect to help your community? How can you view the wider healthcare issue in your community and decide to do something about it? Not for economic gain, but to ensure safe services for the community. Today we're learning about Dr. Emma Wheeler. Emma Rochelle was born on February 7, 1882, in Gainesville, Florida, to a loving mother and a wealthy father who supported his family as a veterinarian. At a young age, Emma fell ill. The illness was concentrated in one of her eyes, requiring treatment. Her father took her to be treated by a white female diagnostician. When Emma saw the female physician, she was amazed, and the two became friends. The two remained in contact throughout Emma's life, even visiting Emma during her studies at Cookman Institute in Jacksonville, Florida. Upon graduating, Emma Rochelle married Joseph Howard in 1900. Tragically, her husband died 1 year later of typhoid fever before the birth of their son, Joseph Howard Jr. Shortly after the death of her husband, Emma Howard moved to Nashville, Tennessee, with her young son. She began studying at Walden University and fulfilled her dream by graduating from Walden University's Meharry Medical, Dental, and Pharmaceutical College. She married Dr. John Wheeler the same week she graduated from Meharry. After graduation, Dr. Emma Wheeler and her husband, Dr. John Wheeler, moved to Chattanooga, Tennessee. The two doctors started their medical practice on Main Street, operating for 10 years until Dr. Emma Wheeler bought 2 lots on East 8th Street at the corner of Douglas in 1915. On July 30th, 1915, the construction of Walden Hospital was completed. The hospital had 30 beds, 9 private rooms, and a 12-bed ward. The hospital also contained surgical, maternity, and nursery departments and was staffed by 2 house doctors and 3 nurses. 17 physicians and surgeons from Mountain City Medical Society utilized the new facility to admit their patients. Wheeler's earlier medical practice and Walden Hospital were very much needed in Chattanooga, as existing medical facilities and hospitals either denied medical attention to Black Chattanoogans or treated them in the basement, a practice that was even prevalent at Erlanger Hospital. This substandard treatment and medical overbilling were not lost on the Wheelers, helping fuel Dr. Emma Wheeler's decision to establish her own hospital. Although Dr. John Wheeler admitted his patients to the hospital, Dr. Emma Wheeler paid for, managed, and operated the hospital herself. She worked long office hours and served as the hospital's superintendent. Walden Hospital was so successful that the building's debt was paid off in 3 years. Dr. Emma Wheeler performed numerous surgical procedures, but she found it to be too exhausting, along with her other duties. Still, she continued to serve her community and expand services to better meet their needs. For more than 20 years, Dr. Emma Wheeler operated a nursing school with her husband's assistants. The two of them taught and trained many students. In 1925, Dr. Emma Wheeler established the Nurse Service Club of Chattanooga, a prepaid hospitalization plan separate from the hospital's operations and the first of its kind in Chattanooga. A very innovative plan that further highlights Dr. Emma Wheeler's commitment to providing medical care. Chattanooga was an industrial city, home to factories, mills, saddle factories, hosiery mills, and steel mills, including Wheelan Foundry. African American industrial workers were paid the least by these companies, despite working the dirtiest, hardest, and most dangerous jobs. Dr. Emma Wheeler's son would later work in some of these industrial jobs. In 1949, the Chattanooga branch of the NAACP voted Dr. Emma Wheeler as the Negro Mother of the Year, as her services to the Black community went beyond the hospital. She was a member of the Mountain City Medical Society and the State Volunteer Medical Association, and she also served as treasurer and a member of the Board of Trustees of Highland Cemetery, a once segregated cemetery for Black Americans. The cemetery still exists. Unfortunately, the cemetery office was destroyed in a fire years ago, and cemetery records and documentation are not easily accessible for those tracing their family history or walking the cemetery grounds to find a relative. Highland Cemetery is the resting ground for some of Chattanooga's most prominent Black Americans, who had limited burial options. The Wheelers had settled in Chattanooga, providing dignified Medicare service to Black Americans who faced the unimaginable under the Southern reign of Jim Crow. Dr. Emma Wheeler was a prominent force in the Chattanooga community. Alongside her husband, Dr. John Wheeler, she was a member of the Wiley Memorial Methodist Church. Another legacy beyond the Walden Hospital occurred in 1925, when Dr. Emma Wheeler, Zenobia House, and Marjorie Parker organized the Pi Omega chapter of the Alpha Kappa Alpha sorority, extending herself outside the hospital, serving others, building plans, services, and avenues for people in her community to take part in. Dr. John Wheeler passed away in 1940. According to a 1940 publication of the Atlanta Daily World, his death was a shock to Chattanooga. He had undergone an operation and had not recovered. Before serving Chattanooga with his wife for 38 years, he began his educational journey in Illinois and graduated from the Meharry Medical College in Nashville, Tennessee in 1903. In 1951, Dr. Emma Wheeler's health began to decline. She retired in June 1953. Upon her retirement, Chattanooga's first and only African-American owned and operated hospital ceased operations on June 30th in 1953. Walden Hospital had served Chattanooga's African-American community for 38 years. While there were other facilities like Carver Memorial Hospital, which served Black Chattanoogans, Walden Hospital was the only hospital owned and operated by African Americans serving their community, not as a government entity or because of charity, but because of Dr. Emma and Dr. John Wheeler's integrity to serve their community with safe, affordable, and dignified Medicare. For some time after her retirement, Dr. Emma Wheeler continued to practice general medicine, receiving and treating her patients on the first floor of the former hospital building. On September 12, 1957, Dr. Emma Wheeler passed away at Nashville's Hubbard Hospital. She was 75 years old. Dr. Emma Rochelle Wheeler, a pioneer who provided health care to a neglected community in the South, created a safe haven for people during some of their most vulnerable moments, prioritizing her patients and her community over profits. Dr. Emma Wheeler's body was returned to Chattanooga, Tennessee, and she was buried next to her husband at the Highland Cemetery, where she had served on the Board of Trustees. In 1962, 5 years after Dr. Emma Wheeler's death, the Chattanooga Housing Authority named Chattanooga's newly constructed housing projects after her, Emma Wheeler Homes, notably dropping her title as doctor. While we are not discussing the history of housing projects in this video, here's some brief history. Housing projects in the United States were a federal government experiment that trapped generations of African Americans living in housing projects. These were not homes that African Americans could own, but rented spaces that became underfunded when white residents moved to the suburbs, if they lived in certain housing projects in the first place. In some instances, that was the case, and when housing projects had white residents, they received adequate federal and state funding for upkeep, and welfare programs did not have income restrictions. The no man in the house rule did not go into effect until more African Americans were able to receive welfare assistance. Emma Wheeler Homes has gained a reputation. The city did not create a program or initiative to reopen the hospital. Instead, it is an apartment building for the area's new white residents, part of gentrification. 10 years after her death, the Chattanooga branch of the Association for the Study of Negro Life and History paid homage to her life and her contributions by recognizing her as one of the city's pioneering African American women. On February 16, 1990, the Tennessee Historical Commission approved the placement of a state historical marker in front of the former Walden Hospital. According to census records, Dr. Emma Wheeler lived in the hospital with her family. Dr. Emma Wheeler's son served in the U.S. military during World War I. He passed away in 1970 at the age of 74. Dr. Emma Wheeler's son, Joseph Howard Jr., did not follow in the footsteps of his mother. It is interesting because he witnessed the brilliance of Walden Hospital. His story is unknown and should have been captured through interviews. Instead, the city named a housing project after Dr. Emma Wheeler, one of the most giving, business-savvy, and pioneering women who gave her all to serve those neglected by traditional facilities and their officials. Have you heard of Dr. Emma Wheeler before this video? Let me know in the comments. I'd love to hear from you.